Hello everyone, welcome to Community Medicine Insight. In this session, we will learn about Ayushman Bharat Digital Mission. In today's video, we will discuss about various stakeholders in the digital ecosystem, the various components of Ayushman Bharat Digital Mission that includes Ayushman Bharat Health Account, Healthcare Professional Registry, Registry of Health Facility, Personal Health Records, and Unified Health Interface. We will also discuss the advantages and the limitation and challenges of Ayushman Bharat Digital Mission. Ayushman Bharat Digital Mission, which is also known as ABDM, was launched in the year 2021. It is a flagship initiative of Government of India and it is implemented by National Health Authority. Earlier, it was known as National Digital Health Mission. It is a part of Ayushman Bharat initiative. Ayushman Bharat Digital Mission is the flagship initiative of Government of India that aimed at building an integrated digital health ecosystem in the country. Bring all the stakeholders together in one common ecosystem so that like patients, doctors, hospital, lab, pharmacies, all they are connected digitally. In the center, we have citizens and patients. So, in this ecosystem, the stakeholders include the policy makers, administrators, various NGOs, healthcare professionals, allied private entities, and the providers. Policy makers include central and the state government. In healthcare professional, we have a doctors, including modern medicine, Ayush doctor, and other professional. Then who are the providers? That includes the hospital, clinic, and along with lab, pharmacies, wellness centers. In private entities, we have various insurers, health tech companies, and in administrators, we have the program managers and the regulators. What are the key components of this Ayushman Bharat Digital Mission? There are 5 components. First is the ABHA, that is the Ayushman Bharat Health Account. Then we have a Healthcare Professional Registry. Third is Health Facility Registry. Fourth is Personal Health Record App. And fifth is Unified Health Interface. We'll see them one by one in the upcoming slides. Coming to Ayushman Bharat Health Account. ABHA is a 14-digit unique health identifier which is given to the individuals. Through ABHA, individual can link their health record, access their health record, and share their health records digitally across different health facilities. And ABHA is voluntary and it is not compulsory. So you can consider that ABHA is a digital locker for our health records. And earlier ABHA was mostly created using Aadhaar, but currently Aadhaar is not mandatory and ABHA can also be created using mobile number or other valid IDs. So anybody can generate its ABHA number by visiting the government website using their Aadhaar card and mobile number. Coming to Healthcare Professional Registry. In healthcare professional registry, it is the registry of verified public as well as private healthcare professionals serving across the all system of medicines. So, healthcare professional registry is a comprehensive repository of professionals including doctors, nurses, and allied healthcare professional, and it includes both the modern system as well as the traditional system of medicine. What is the importance of registry of various healthcare professional? Since we have seen that it will be verified public and private healthcare professional, so that will help in the reducing the quackery. And patient can identify the authentic and registered healthcare providers. Coming to health facility registry, that helps to connect and deliver the healthcare services digitally across India. It is the registry of verified public and health facilities. Earlier, we have registered the doctors, nurses, and the allied healthcare professionals. In this, we are registering the various health facility, including hospital, diagnostic labs, pharmacies, and health centers. And in this also, both the public as well as private facilities are included. Healthcare facility registry will help in the digital referrals. It will also ensure better coordination and smooth delivery of healthcare services. The personal health record app allow individual to store and manage their records digitally. It will be ensured through the applications like ABHA app, Arogya Setu. This will allow the easy management of their personal health records. And the benefits of using a PHR app includes the consent-based sharing, a secured storage of digital health records, and it will help in the linking records from different health facilities. So, control here is given to the patients and not to hospital. So, without the consent of the patient, the records cannot be shared. Next is Unified Health Interface. It works similar to UPI system in banking. What happens when we use UPI? It connects the different banks through the one interface. Similarly, in the Unified Health Interface, it is a platform that combines different parts of healthcare applications and services data into a unified interface. Means it connects a healthcare service provider and patients on a one digital platform. This platform can be used for various purposes like teleconsultation or for the OPD booking, or it can be used for lab test or various e-pharmacy services. It enables the seamless interaction between the patients and various healthcare providers. The advantages for patients include more choices of doctors and services, transparent pricing, easy comparison of services. For healthcare providers, it will include the wider reach to patient by increasing the discoverability for healthcare providers and the facilities. There is no need to build expensive platforms and easy onboarding into digital health ecosystem. The healthcare system, it promotes standardization, it encourages the digital innovation and will help in strengthening the ABDM ecosystem. What are the advantages of Ayushman Bharat Digital Mission? A unique ABHA ID will be used for lifelong digital health records. It will allow easy access to prescription, lab report and discharge summaries. Continuity of care across the public and private health facilities. and reduce duplication of tests and medical errors. Hearing is consent based and it is controlled by the patient. It will also save time, improves efficiency of health services, supports telemedicine and digital health innovations. This data will help in the public health planning and surveillance. There are lots of limitations and challenges also in the implementation of this program. That includes digital divide. It means access to the digital services is not uniform everywhere, particularly in the rural, poor, tribal areas. There is a limited digital literacy and smartphone access. Other concerns include the data privacy, security concern, inadequate IT infrastructure in the peripheral health facilities, and there will be resistance and increased workload for the healthcare providers, interoperability issues with the existing hospital system, lack of awareness and the understanding of consent among users, and there is a evolving legal and regulatory framework within the India.